Hi, this is Kathy Kress again, and I'm doing my YouTube channel, Geriatric Care 1, and we have done a lot of segments, and we are now to the point where I am talking about you are going forward, you are going to add geriatric care management to your nonprofit, and I'm talking about some of the roadblocks and some of the positives, and if you have roadblocks, how you get over them. So, the challenge to a nonprofit in adding geriatric care management is that essentially it has to do with people, in that you are going to have two staffs. And a private geriatric care management staff is on 24-hour call. That's just the way it works with private geriatric care management, because you have very highly intense clients. You have to have a small caseload to do that, and there are clients that demand a lot because they're middle class and wealthy, and their adult children want you to succeed. So you have small caseloads, and that's a real rub, because in a nonprofit, usually the care managers or anybody that works there works 9 to 5 and has a large caseload. And so this rub can start between your staffs when you add geriatric care management, because the geriatric care manager is working with less family groups, yet they're working harder and they're on 24-hour call. And the nonprofit staff works 9 to 5, but has a larger caseload. So the way you deal with this is you've got to do a lot of internal education. You've got to show the nonprofit staff what the benefit is to them. You know, that your bottom line will be increased by this for-profit arm that will be able to reduce their caseloads, that will be able to give more services to the poor or the needy or whoever you serve. So that takes a lot of education among your staff, both staffs, and combining them and letting them work as a team. And another challenge is hiring a geriatric care manager. And a geriatric care manager is a very special person. They need to be certified in geriatric care management. And that means that most of them have masters in social work, nursing, whatever, in the health field. It's not whatever in any field, whatever in the health field. Usually about 5 years of experience in the field, because you're dealing with really, really difficult dysfunctional cases, end-of-life cases, things that are crises. And you have to have a lot of experience, and you also have to learn you have to hire somebody that knows how to work with entitled clients, because upper income elderly clients are entitled. They demand a lot, and they can be very difficult. Plus, you have to hire someone who accepts billing, and we've been talking about that all along. This problem in nonprofits about a for-profit selling and nonprofits don't. Most people in the healthcare field that come to you, they are adverse to selling. I was trained as a social worker at UC Berkeley to be a social worker, not to sell. So you have to find a geriatric care manager that can do that can bill. And you also have to find someone who is used to very, very careful documentation and going to court, because a lot of times these cases end up in court and end up in conservatorships or in some fiduciary manner, and that can go from one crisis to another, because that's what happens. That's why you have a small caseload, is that you have these highly complex clients, and you're off from one, you solved a problem, and on the phone is somebody else who has a new problem, and you've got to go to that. And, when you work a 9 to 5 day, you go home and leave it. You usually aren't dealing with crisis after crisis after crisis. So it's a very special person that you have to hire, and that's another challenge. That can be done, that can be handled. And so we will do our next segment, and always go to my website, kathykress.com. Thank you.